I'm here with Dr. Azim Kasmani, the Public Health and Preventative Medicine Resident Physician at Queen's University. Hi, Dr. K.
Hi, thanks for having me.
Well, this is becoming a weekly visit to give people a status report on how things are going on the front line for you. I guess the first thing this week, just give me a status report, particularly now we have community transmission and it seems to be deepening. Is the self-isolation helping from your end? And maybe just tell me what news we have from the assessment center that's been set up.
Yeah, so far we have, I think last I checked, it was 46 cases within the Kingston, Frontline clinics in Addington area. Most of these cases have a link to somebody else who is already unwell or has traveled. So there is evidence that the physical distancing measures are really helping. We're seeing our neighbors to the south, where they were later in their trajectory implementing some of those measures, and other countries in Europe, for example, where they were later in implementing some of the physical distancing measures, and they're much further along as a result, partly of that. So I think they really are helping, and it's really beneficial, and we're really grateful for everybody doing their part by staying at home, by limiting their contact with other individuals. We've seen the government put in new measures, closing even more areas where people can congregate, for example, and limiting group gatherings to no more than 5 people.
The assessment center was set up last week or the week before, one or the other, and we have that tool now in Kingston. How's it looking inside that establishment?
It's going pretty well. They're able to assess people every day and then provide advice, and one provides screening. And then beyond that, they're able to test people who need to be tested, who meet the criteria.
So one of the things that people are starting to do now, I mean, everybody seems to be trying to help, and people are making masks for their own use and for hospital, for caretakers, because the supply chain is just getting ramped up. What do you think about that? Is that a good idea? And what precautions should people take if they are going to make themselves a mask?
So masks are an interesting topic, and I don't think the science is settled on them. In different jurisdictions, they have different cultures which may promote the use of masks versus our culture here, which may be different from theirs. There may very well be a value in masks, but right now, the store-bought masks, the hospital-grade masks, we are trying to preserve for our frontline workers in the healthcare sector, whether that be the doctors or nurses or other allied healthcare providers who are providing care for patients, or the staff who are working within the hospital, say in terms of cleaning the rooms afterwards. They need that. They need those quality masks. We don't want people to go out and try to buy all the masks there are, and so that's why we're encouraging that if people are unwell, they may choose to use a mask to keep their, let's say, sneezes or coughs from spreading any droplets out. And homemade masks may be one way to do that, although I'm not sure on the science, exact science on how well they protect. If people are using homemade masks, it's important to wash them or dispose of them when they become soiled or dirty, not to just reuse them. And it's also important not to get complacent, to think that, oh, I'm wearing this piece of cloth, this bandana, whatever it may be, this t-shirt, that means that I can't get sick or get anyone else sick. It's still very important to continue practicing those physical distancing measures.
So there's no such thing as an invincibility cloak in this pandemic?
No, not yet. One day, hopefully soon, and soon being a relative soon in terms of our previous attempts, but to get a vaccine, that would be the best thing we could hope for. but even that would be still some time away.
Right. How are the frontline healthcare professionals coping with this in Kingston? Like specifically in Kingston, we know that elsewhere there's been it's been a real challenge. How's it going here?
Well, overall, there's some challenges, but everyone's rising to the occasion. So Kingston Health Sciences and their staff have created extra, have made space in the hospital essentially by, and patients have really stepped up as well. Getting patients home who can get home, getting them to other locations where they can be safe and out of hospital. Everyone in our community has really played a role in that. I know, for example, our our physicians, nurses, and other allied healthcare workers have been practicing with simulation, uh, running scenarios, where they'll be practicing for what to do when cases come in. They've been following up with information from their colleagues in the States, in Italy, in China, and seeing how they're treating people. And everyone is ready to work and work hard to make sure that we can manage the situation coming as it comes.
Perhaps the most important question of all, how are you coping personally? How are you and your family faring in this crisis?
We're doing well. Thank you for asking. My wife is actually a palliative care physician, so she expects that her work will be changing a bit, and the number of patients she has to see will be changing a bit. Hopefully, with everybody practicing their physical distancing, we're going to see that it won't be changing so much. We have a little one at home as well, and so grandparents are being very helpful because daycares are closed. And so making sure that they are cared for, or, Nora is receiving the care at home, which allows us to keep working and hopefully helping out. And the other things that I recommended last week for everybody is eating well, getting a good night's sleep, exercising when you can, and disconnecting every once in a while from everything that's going on and taking time for yourself. Those are some of the strategies we're using in our house, and they seem to be helping so far. We're also using a lot of methods like this to communicate with family who is elsewhere, whether it be through video chats or phone calls, to make sure we're staying socially connected.
Okay, you just answered my last question, so I'll go back to my second to last and first to last, third to last question. Just basically, we'll end this for the week, but just go over some of the basics again for people who may not have seen, may not have, if you feel you've got symptoms, for example, who do you call, and what's the assessment center protocol?
So if you're feeling unwell, the first thing to do is to, and we should be doing this anyways, but to limit contact with other people. The Ontario.ca website has a very good assessment tool there where you can plug in your symptoms and they ask different questions to get a better sense of things. And then that gives you advice on exactly what to do, whether you are at risk for having the novel coronavirus, COVID-19, and the next steps to take. So that's where I would recommend everybody go. Telehealth Ontario is another spot where people can go. Right now, we are following, the ministry has put out guidelines on who can receive testing. If we had enough tests, we would test everybody with symptoms. That would be the most ideal way to go about things. But unfortunately, we know that the factory where the swab was made is in northern Italy, where they are experiencing their own issues. And despite that, the Ontario government is working really hard to maximize the amount of testing available and increasing it every day. And so that website will tell people where they can go, or if they should go, or if they should self-isolate, or who they should contact. But right now, the focus for testing is frontline healthcare providers. It's people who live in congregate settings. So, for example, living in a nursing home, long-term care home or retirement home, or a group home, for example. People living in rural, remote, or Aboriginal communities, are priorities for testing. And there's another category that another two categories I can't remember off the top of my head, but it's basically the higher risk people where an outbreak would have an effect and quickly be able to spread amongst people, as we've seen in some other jurisdictions near us, unfortunately.
Okay, so people shouldn't just wander down to the assessment centre at the Memorial Centre. They should go through telehealth or ontario.ca first before they show up there?
Yeah, absolutely. And that will save them their time and make sure that they're not waiting for a test that they don't get. As well, even if you are sent to the assessment center, not everybody who is seen there and assessed there is receiving a test. Some people may maybe not receive a test and receive advice on how to either self-isolate or monitor for symptoms depending on the assessment there.
Okay, that's great, Dr. Kasmani. We'll talk to you next week. We'll leave it at there for now. Always enjoy talking to you, hopefully, and don't take this the wrong way. We don't have to do it for the next 6 months, but we will talk weekly.
I appreciate that. I appreciate where you're coming from, but we'll be optimistic, but realistic at the same time.
Yeah, let's do both. All right, thank you. We'll talk to you next week. Bye-bye.